I think it is imperative that you all are on the front lines of making our congressional delegation aware of how harmful this will be to the hospitals, to providers, to jobs, because I don't think they're hearing enough from the hospitals. And I also just want to reemphasize something that Leader Morgan mentioned about the power that we have in influencing our congressional delegation when they're taking these votes. And I know we've been through cuts in the past. I wish this was just fear-mongering, but it's just basic logic. If people don't have health care, they're not going to seek out health care because it is too expensive for them. If they don't get that health care, they may die. They may face significant health impacts that will result in their death. It's as simple as that.
There are individuals in here that truly care about people who cannot take care of themselves. There are individuals here on both sides of the aisle that truly care. And I've had discussions, especially over the past 2 or 3 years, with individuals about how we keep shoving people into a program, Medicaid, that underpays for health care. The reimbursements are not good, and I know that individuals have talked about trying to make progress, but if we keep shoving more and more people into a system that underpays health care, what does that do? The private side, something has to cover that loss, right? I understand it's a good feeling if you're a provider, it's better to receive something than nothing at all, but something in the system has to cover the additional cost of the actual health care provided. So shoving more and more people into a system that sounds like, to me, and I do not work within the system, I've heard about it for over a decade. If we continue to shove people into the system that's not actually paying for the cost of health care, how are we helping the system? I have a number of questions that I would certainly like to ask the director. I would like to ask DCFS some questions as well. But if this was a less political process, and I know we live in a political world, but if we cared about the policy, it wouldn't be about the politics, it would be about the policy. And I hope that we can focus in the future on the policies that actually help people who truly need help.
I think Representative Costa Howard made it very clear how it will impact you all, but